Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Alex DeRuggiero, a certified pediatric nurse from Baltimore, Maryland, with a BSN, Bachelor of Science in Nursing from Salisbury University, and a Master's of Science in Nursing in Community Public Health from the University of Maryland. A former traveling nurse with experience across Maryland, DC, and Virginia, she now works as a pediatric population health strategy consultant at CareFirst Blue Cross Blue Shield. Alex graduated from New to Public Health in September 2024. Thank you for being with us today, Alex. You have a really unique role at CareFirst. Can you tell us more about the value of having nurses, specifically public health nurses, in the insurance industry?
Well, thank you so much for having me here, Juliana. I enjoyed my experience with New to Public Health, and it really played a huge role in me transitioning into my current role with CareFirst Blue Cross Blue Shield, and really laid the groundwork for my role as a public health professional. So thank you so much for that. And to answer your question about how working in the insurance industry is, it's unique. It's a unique role for a nurse. So a lot of people are quite surprised when I tell them I am a nurse, I work in public health, and I do work for a payer in the insurance industry. It takes a bit of explaining, but if you think about it, our healthcare system is quite complex. It's really fragmented, for better or for worse. And it's important to have representation with public health professionals in every piece of that puzzle to really make a difference and make sure that our goals are aligned as a workforce. So through working in the insurance industry, I can bring my clinical expertise, I can bring my public health expertise, and have conversations with people that are paying for healthcare, because ultimately we know how closely payment and results are tied together. So a lot of times, we need to drive change through using different payment frameworks. So I use my experience as a nurse and a public health professional in my current role with CareFirst. I learned from New to Public Health and from my education what's important, and I try to stay on top of current events to see, what needs to be addressed most, and try to make that align on my end with CareFirst. And I know it's only one piece of the puzzle, but I feel like it does really make a difference.
Yeah, it is so vital to have nurses woven through all aspects of healthcare. And you can imagine having a public health nurse as an advocate in a payer industry can make all the difference on that care continuum. So tell me about some current initiatives that you might be advocating for in this role.
Yeah, and that's a great question. So it's ever changing. We try to keep up with the rapidly changing public health field and healthcare field in general. Currently working with children and adolescents, vaccine is always at the forefront, or vaccinations are always at the forefront of our minds. It's a huge tool in our toolbox to protect children and adolescents from communicable diseases. We're working currently based on national data. We see that there are some dips in vaccine compliance, just as a national trend, with more exceptions being requested. And, it's really vital to make sure that primary care providers are having great relationships developed with children and their families and educating them about the importance of vaccines. And so I kind of work on behalf of CareFirst with primary care providers to help them strategize about having conversations with families to kind of, remedy some of the worries that they have around vaccines, strategies to get them to perhaps reconsider vaccinating their children. One current initiative, if you're familiar with the HPV vaccine, it is one of those optional vaccines, but we know that it does protect children, adolescents against several types of cancer. So historically, providers have trouble having conversations with families about getting another vaccine on top of all of the standard vaccines that they're getting. And a lot of times there's, stigmas surrounding this vaccine and misconceptions surrounding this vaccine. So just a lot of education, which as public health professionals and as a nurse, education and behavior change is kind of everything that we do. Just behavior change in all senses of the word. And we work with primary care providers. I work with pediatricians to drive behavior change, but they're really the ones that are implementing the change. So they're spread throughout the DMV. The providers that I work with are in DC, Maryland, and Virginia. This HPV conversation, initiative that I'm working on is just one of several initiatives that I work on with them. I kind of let them let me know what needs to be worked on because they know their populations best. It can be anywhere from HPV vaccinations to depression screenings to social determinants of health being addressed. And as a payer, we're able to trend and track data and partner with these community advocates to address what they see as important. I'm not very prescriptive. I don't like to go to people and say, this is what's important, this is what we're going to do. Of course, there's a component of that, but they know their patients, they know their members. I'm here to support them with the tools that we have.
Thank you for sharing that advice, Alex. Networking is a great way to explore new career pathways and to learn and grow from a diverse community. I also want to end with highlighting the importance of public health being in diverse settings, including for-profit spaces, so that we can really share that population-driven perspective on all types of issues. Because when public health nurses are part of all spaces, we have more power to help raise up issues that are important to and affecting the health of people and populations. So, Alex, thank you so much for being here today and for your work and contributions to the field of public health.
Thank you for listening to Field Notes, insights from New to Public Health alumni. For more information, visit new2publichealth.wisc.edu.